Hello, everyone, and welcome to another discussion with the Fierce Healthcare team. I'm Tina Reed, and I am joined today by Paige Minnemeyer, Robert King, and Heather Landy, where we'll be talking a little bit about what we covered this week. The big theme this week was earnings, but first, I was just going to check in with you guys. It's been just about 2 months since we've all been working from home. How has quarantine been going for you? What have you been doing to pass the days and make it a little bit easier? Robert, I noticed you're wearing a hat.
Yeah, I'm wearing my Washington Capitals, see if you can get that, Stanley Cup champion hat because my hair has grown to very unwieldy proportions. You can't go to any barber or salon, so you just kind of have to make do. So since my hair isn't camera ready, I decided to put a hat on.
Very nice. Well, I'm glad you're representing DC. That's very good. How have you been spending your time? What's been making quarantine a little easier?
Well, Michael Jordan's The Last Dance documentary has been pretty interesting to kind of watch. I'm all caught up now, and that's been pretty cool, pretty fun to kind of escape, get back to the 90s.
Very good. Paige, what have you been up to?
Sports is like going to be a recurring theme today, I guess, because that's kind of been my quarantine entertainment too. We didn't get to have our spring game in the Penn State fam, so I've just been kind of watching some older games and games from last season to like imagine and fantasize and hope that maybe I'll see a football game sometime in 2020. So
and Heather, how about you?
Well, besides taking my dog for mini walks every day, lately I've been enjoying some live streamed music. Some of my favorite musicians have been doing like live streamed kind of like concerts from their homes. And so that's been a good way to pass the time. And it's actually kind of nice. You don't have to leave your house and you don't have to like stand in like a smoky bar or something. So there's some benefits to live streamed music from home.
Very nice. Yeah, you can enjoy a little cocktail at home and, watch. Now, I have been reading a lot more, and I actually made a big decision that I think I'm going to finally break down and read the Harry Potter series.
Really?
So this breaking
big news for the team, actually. Big news.
20 years late to the game here.
Soon we'll get you to watch Game of Thrones.
Someday. Baby steps.
Very soon.
Well, anyway, let's move on to earnings. It was kind of a roller coaster just looking at the earnings these last couple of weeks. And obviously the earnings season was only capturing January through the end of March. And COVID really started hitting all these industries about mid-March. So we're not even really capturing the full impact. But what were some of the messages that companies were putting out with their Q1 earnings reports these last couple of weeks? Paige, what were you seeing with payers?
The big private payers kind of overall are actually performing quite well in Q1 and kind of see that sticking through the rest of the year. I mean, I don't really think you get a sense of financial panic from them, but they are kind of pulling back some of their guidance and saying, acknowledging the uncertainty that kind of surrounds the industry and, the finances there. They're really, not seeing yet, though, kind of the big impacts that they're looking ahead towards. So in Q1, I mean, everyone's performance was pretty consistent across the board. There was no, kind of big financial hits, and they all pretty much acknowledged that they, at the beginning of the year, haven't seen much of an impact yet from COVID. So.
Now, Robert, I know that certainly is not what hospitals are reporting. What were some of the major health systems, like Tenet and Universal Health Services, Community Health Services, and HCA finding?
Well, so it's important to remember that the financial results are only through the end of March. So a lot of the major health systems, like Tenet, for example, posted a $94 million profit in the first quarter. And I believe HCA also posted a profit, about $581 million in profits. But it's important to kind of put that as a caveat that we still don't know what the full impact of COVID-19 has on the earnings for these major healthcare systems. You know, a lot of systems started to cancel elective procedures back in kind of midway through March when the pandemic really started to get into full swing, and kind of states across the country implemented stay in place, shelter in place orders. So both Tenet and HCA have kind of put out, kind of took away their outlook, their financial outlooks for 2020, because they are worried about the uncertainty of COVID-19. These a lot of healthcare systems also have implemented furloughs. Tenet, for example, kind of implementing furloughs of about 500 full-time workers. Other major healthcare systems, Trinity Health, Bon Secours, Mercy Health, Detroit Medical Center, Michigan Medicine, just this past week said that they're going to furlough and lay off, I think, about 240 employees. So really, we got the first part of the financial storm in the first quarter of the year. And the second quarter financial results are really going to show how difficult it's going to be for these healthcare systems.
One thing I thought was interesting with the health systems as well, both the publicly traded health systems and then some of these major health systems, in some of their communications the last couple of weeks, is one of the ways they're trying to shore up their finances and try and take care of their liquidity crisis. They're just cutting off their capital projects. So one big example of that was Michigan Medicine, where they're going to suspend plans to build a new hospital building, and I know that's a massive project up there in Ann Arbor. So it's going to be interesting to kind of see what happens with some of these projects that were already in the works versus those that were just in the planning stages, and how many of those actually end up going forward. Now in IT, Heather, what were you seeing? Because I know there's a kind of a big mix of companies that you cover.
Right. Kind of going into the first quarter, a lot of health IT companies were saying that they were on pace to have a solid quarter, a lot of the big EHR vendors. And then they started feeling the effects of COVID in about mid-March. For the EHR vendors, the drop in patient volumes at their provider clients really started to impact their revenue in about mid-March. A lot of companies reporting, losses for the quarter as opposed to profit. But there were some bright spots. The companies that focus on virtual care had were really great quarters. Both Teladoc and Livongo Health basically raised their forward guidance for 2020. Teladoc revenue was up 41% in the quarter, and Livongo had a revenue jump of 115% in the quarter due to the accelerating use of remote monitoring technologies. Okay, so definitely some different stories coming out of that sector. So as we look forward into Q2 and beyond, what were some of the interesting takeaways that you heard from the different companies that you cover that you think might help us know a little bit more what to expect in the coming months? Paige, what did you hear any indication of what you might expect from the payer sector?
Yeah, I mean, there's a couple of things that they're really looking ahead to. One is kind of a changing membership pool and kind of looking at how the job losses that have kind of resulted from COVID could impact, different levels of membership in their different business lines. Most of them are expecting a potentially significant decline in the commercial membership, but that's likely that could be offset in enrollment in Medicaid on the individual market, and that there's kind of a potential for some balancing there. They're also really kind of looking ahead as hospitals and providers begin to open up their doors more and reignite some of these elective surgeries and procedures. They're kind of looking ahead at a crush of claims potentially, and just much higher demand for services in the end of the year that could really kind of impact the potential boosts and boons they were seeing at the beginning of the year. And they're really just unsure of how much that's really going to turn out. I've heard from some insurers, and I know Cigna has put out some data on this, that they're also just kind of concerned and watching whether or not kind of the deferral of care later in the year due to COVID will lead to an uptick in demand and need for treatment for people with chronic conditions, or kind of with, non-elective needs, but actual care demands beyond that, and that could impact, if their conditions worsen, then obviously that's more expensive for the insurers to cover, to treat those needs. But I mean, something to kind of consider at the same time is that, these big health plans are very profitable. They're very wealthy. They have a large war chest kind of available to them, that if they're looking forward and saying, okay, we could really experience some significant impacts towards the end of the year, they can really kind of start preparing for that now and think about that. These are also really diversified companies when you look at them kind of compared to maybe a health system where they have their vertical level of integration. They have so many different business segments and so many pieces of the puzzle that make them up, that if you're seeing a lot of impact in, say, their provider services that they cover, they have, if you're CVS, you have a highly profitable retail pharmacy chain that still has a ton of demand right now. So they also have that ability too, to really kind of look at their business lines and kind of spread things out a little more to mitigate some of the impacts that they could look at financially through the end of the year.
Now, Robert, how is that playing out on the health system side of things?
Well, the big question is going to be, as Paige alluded to, the resumption of elective surgeries, which have been largely canceled for over a month now. HCA, I believe, said in their earnings call that they're looking to restart elective procedures. A lot of major healthcare systems have already started looking at this as well. But the question is, how can you do it? How can you do it safely? And also, how can you inspire confidence in consumers to even return to the hospital to get a surgical procedure that they've been holding off? I just spoke with the main chief safety officer at Common Spirit Health, and they said that that's been a big focal point in their kind of toolkit that they've created to kind of help assist hospitals that are ready to restart elective procedures. So that's a major, major question mark for these hospital finances, is not only how long before you can start to resume elective procedures, but whether or not consumers are even going to be confident enough to go to the hospital at all.
And I know there's been a lot of question too about what happens if and when a surge happens in the fall, if things start getting shut down again. And I know one health system actually said, they're thinking of it in terms of if they can get elective procedures up and going again during the summer, they can kind of get some of those out of the way before they end up having to shut things down again, and kind of making their plan in that way. But it's going to be interesting to see how things play out in the fall if we do get those surges again.
It's important to note that for these healthcare systems, COVID-19 is not going away. They're still going to have cases. It's looking like we're having a persistent spread in some areas of the country as well, outside of New York, which is kind of the main area that's seeing pretty heavy declines. So you're still going to have to plan for how do you segregate COVID-19 cases, how do you have enough staff, enough PPE for not only kind of these elective procedures, but also for a potential resurgence of the virus.
Now, Heather, I know that you actually talked with tech experts this week in a webinar where they're saying with these changes that are happening in healthcare, they see some of the way they do business and the way consumers expect to get healthcare is going to change permanently. Can you talk a little bit about what they were saying and kind of how that is going to play out for health IT companies in the second quarter and beyond?
Right. Yeah. A lot of the EHR vendors, the health IT companies, just in this past quarter and going forward, saying they are really focused on virtual care, helping their provider clients ramp up telehealth. That's been their big focus to try to kind of offset the revenue losses from other sides of their business. The tech experts that I've spoken to really think that telehealth and this uptick in telehealth and remote patient monitoring is here to stay. Especially for patients that are have multiple chronic conditions, who are most at risk for getting severely ill from COVID as the virus continues to circulate. Those patients, it's going to be quite some time before those patients can go back into a doctor's office. So a lot of experts are saying, you know, this virtual care, remote patient monitoring, that we're going to need that to have that in place going forward for a lot of these patients. So I guess the question is how, you know, some of these EHR vendors are really going to have to kind of change their focus and really focus on new capabilities, especially the EHR vendors. They're facing some headwinds anyway because that market is pretty saturated. Most providers have EHRs. There isn't a whole lot of growth there, just in the traditional EHR market. So what I'm hearing, pretty much every vendor is really looking to kind of expand their capabilities, add those kind of integrated telehealth capabilities, and really try to kind of focus on innovation and the tools that providers are going to need in kind of like the post-COVID world.
Okay, well, those are some really interesting thoughts from all of you. Thank you so much for talking a little bit about some of the earnings that you were watching these last couple of weeks. We'll look forward to hearing what happens in Q2. Have a great week, everybody.
Bye.